This is a patient who came to the office having experienced pain on the lower right side. I'm in the process of putting in a crown after we had removed the fillings and found a crack that was the culprit. And you can see part of the fillings that are there. You can also see that I've been removing the cement from the temporary with a micro etcher, and the white powder that I just rinsed off was the aluminum oxide from the white etcher. You can see how clean the tooth is, and that's a piece of cord that was around the tooth to allow me to do a nice job of removing the cement without causing the tissue to bleed. I'm checking the gold crown where the fit between the crown and the tooth is so that it's nice and smooth and that I can't get an explorer or any instrument up underneath it. And I'm looking to see that it's a nice smooth fit in every place that I can possibly get my instrument. And that's one of the benefits of a gold crown is the fit. And this is in a spot where most people wouldn't be able to see it, the lower right first molar, tooth number 30. And it takes a lot of wear. The nice thing also about gold is when you chew on it, it doesn't wear the opposing arch as some of the ceramic crowns do. This patient, after we place the crown in, hasn't had any problems with the crack or chewing and is able to chew as much as possible. Looking at the tooth, it looks fine, so we take an x-ray to verify that the margins are closed, and you can see how the area that's white against the tooth there was completely sealed. Now we're going to take a look at another crown that was done on the other side within the last year by another dentist, and you can see the cement that's gone ahead and placed to keep the all ceramic or tooth colored crown in place, but there's a space between the cement and the crown, and when we take a look at the tooth we notice that there's a really good amount of space where the cement has already leaked away in that short period of time. There are many cements where that wouldn't happen, but in this particular case, the fit of the crown was truly relying on the cement, and you can see the opening that's there. The problem with doing this is that this particular tooth had a root canal on it, so the patient's never going to feel any pain if there's any recurrent decay that occurs underneath the crown. And when that happens, the decay just percolates, and it's possible that one day it would just fall out and he would lose the tooth completely. So having that closed margin be of the ceramic material is always better than cement, and you'd like to be able to make sure now that the tooth is doing well. So we'll go back and look at the root canal, and when we took some x-rays in that regard, it looks like the root canal may not have done a good job of healing, and so the patient has a good possibility that there is a residual infection there, and we'll need to have the root canal done before a new crown. So sealing crowns is a good thing, getting the root canal done